Thanks for joining us for the second session of Understanding Composites, information to make you a better clinician and to advance your career. Today we'd like to take a closer look at foot drop and the two functions of the dorsiflexion muscles during gait. We also want to emphasize the importance of a progressively flexible foot plate, why that's important in a composite brace. And we also want to look at the weight line analysis during unilateral weight bearing and the importance of not enclosing the heel in foot drop braces. The lower leg dorsiflexion is controlled by three muscles in general: the extensor digitorum longus, the tibialis anterior, and the extensor hallucis longus, which goes down to the great toe. All three muscles are innervated by the same nerve, the peroneal nerve. If that nerve is compromised in some way, you lose dorsiflexion of the ankle. There are two functions that the dorsiflexion muscles accomplish. One is to pick the foot up, which is this upward motion that you see here. It also gradually and progressively lowers or controls plantar flexion between the first and second rocker of gait. In a medial view here, you can see that the controlled plantar flexion, which happens in this downward motion, if the dorsiflexion muscles are not active, the foot will just basically slap on the floor. You also will notice that there is more motion here at the toe and less motion, very little motion, underneath the tibia. The reason that's important is because the composite foot plate is constructed so there's very little motion here, and there's a lot of motion at the distal end of the foot plate. So as you look at this again, you'll see that there's quite a bit of motion in this direction, mostly being at the toe. So a composite brace can be designed to mimic the natural functioning of the dorsiflexion muscles during gait. Here are some examples. This particular patient has a fairly severe drop foot. The way he is able to navigate down the hall is to flex his knee and his hip excessively. This is called the steppage gait, and that allows to shorten the lever arm so his leg can swing through without his foot catching on the floor. And during swing, his foot basically points straight down to the floor. You also notice that there's no first rocker, there's no heel strike. He goes straight to second rocker, and that's very typical of most foot drop patients. They just don't, they have a shortened stride length on that side, and they just go straight to second rocker. With the brace applied, though, you can see that the first rocker is reestablished. There's controlled plantar flexion between the first and second rocker, and this toe spring, which picks the foot up so that he doesn't have to have that steppage gait. So there's first rocker, second rocker, and toe spring. This whole brace weighs about 6 ounces, and as you can see, it fits easily into the shoes, and it reestablishes very normal gait. Here's another example. This particular patient doesn't have quite a severe drop foot, but you can see that he has a steppage gait on that left side, where his knee and hip are flexed more on the left than they are on the right. And again, there's no first rocker. He goes straight to second rocker, and there's a shortened stride length on the left side as a result of that. With the brace applied, however, you can see that the first rocker is reestablished. There's controlled plantar flexion between the first and second rocker, and there's good toe spring so that he doesn't have to have a steppage gait on that left side. So this reestablishes a very normal and natural gait, and again, these braces only weigh between 6 and 7 ounces depending upon how tall they are. Here you can see a good example of reestablishing the first rocker, controlled plantar flexion to the second, and toe spring. We also want to look at why you shouldn't enclose the heel of a drop foot brace. Here's an athlete that's running on a treadmill barefoot, and you can see that as his foot is planted on the treadmill, it goes into a valgus ankle position right there, and right there again. It's this valgus thrust that happens when you go from when you're running, when the unilateral weight bearing happens. And the reason for that is because the weight line travels to the lateral side of the ankle joint. And the entire weight of the patient's body is traveling medial to the knee and lateral to the ankle. So this is going to produce this valgus motion that happens. So when you enclose the heel with plastic of some kind, what's happening is at every step, the ankle wants to go into this valgus motion, and the plastic heel that incorporates or contains the heel is just preventing that or stopping that. Or it tries to stop it. It really can't, because there's an awful lot of weight that goes into unilateral weight bearing, depending upon how heavy your patient is. So what this does is that the heel becomes irritated every time they take a step. It also causes increased friction inside the brace, which is also uncomfortable for the patient. So our design goals when we construct a brace is to make the lightest brace we possibly can for the existing pathology. Make sure that it's stiff enough to provide support, and we want to make sure that it's flexible enough to not interrupt the rockers of gait. Actually, we're reestablishing the rockers of gait in a natural way with our drop foot braces. We want to make them low profile as possible so they fit easily into the shoe. And many times the criticism of composite braces is that they're expensive. And they are more expensive than plastic braces, but if your patient has to go out and buy 2 or 3 pair of shoes to fit their plastic braces in, it actually means that a composite brace in the long run might be a better value than plastic braces are, just from the shoe purchase alone. We also want to make sure that we give the patient the most natural gait they can. So here are 3 open heel designs that we make at Custom Composite. And the most popular one is this one here on the left, the posterior lateral strut. This is also a popular one on the right here, the lateral strut itself. The one in the middle is the flexor band, and this one here is for very active patients, and that's the reason for the joint. If you have a patient that wants to run or bend down a lot, do a lot of gardening, or he's an auto mechanic or something where he has to crawl around on the floor, then the flexor band is a good choice. Quick summary of our lesson today. A progressively flexible foot plate assists in dorsiflexion and also helps control that plantar flexion so that there's no foot slap, and it reestablishes that progressive plantar flexion that needs to happen between the first and second rockers of gait. It's a good thing not to enclose the heel with foot drop braces. You simply are irritating the patient when you do, and we want to make something that's easy to fit into the shoes. And all of that is accomplished by those open heel designs that we just mentioned. Thanks for joining us today, and we hope that this information makes you a better clinician and advances your career. Appreciate your attendance.